Again, we are joined by Dr. Alex Jahangir. He is the chair of Metro's Coronavirus Task Force. Thanks so much for your time again.
We want to talk about the flu vaccine, first of all. Big push this year, maybe more than ever, for people to get it because of this pandemic. Will you put in your own words the importance of getting the flu vaccine at this time?
Sure, thank you. I think the big worry everyone has, in fact, federal officials just last week said it, is if we get the flu epidemics, let's say we get a big surge in flu this year on top of COVID, it can really impact a lot of things. There's nothing more reliable right now than getting the flu vaccine to try to minimize flu. And I know in the past it's been really kind of a challenge to get everyone to do it, but right now more than ever, getting the flu vaccine on top of the social distancing and wearing a mask we're doing could result in a really mild flu season. So I implore everyone who can get it to do so.
Doctor, the latest heat map from Metro Health Department, it appears things are improving in the downtown hotspot zone. Is that correct?
Yeah, and not only the downtown hotspot, I would say the entire city of Nashville. We are still hovering at, as I mentioned in the last segment, around 25 cases per 100,000. Just about a month ago, we were at 65 per 100,000. Now, 25 still puts us right on the border of being in the red zone for federally and state-wise, but we really are heading in the right way. And I think it's a combination of what the Nashvillians are doing, the things we've talked about each time, but also, you know, we've stepped up enforcement. Businesses are becoming very responsible. So there's a lot of things we're doing. So downtown is going down, as is our southeast, as is other parts of the city. So we're doing really well. Our active cases have gone down tremendously, almost about half our peak. So yeah, things are going well.
So does this officially mean we are flattening the curve?
We have definitely flattened the curve, and you know, flattening the curve conversations usually revolves around hospitals, and that's one other part of the discussion. 3 weeks ago, 13% of all people hospitalized in Nashville, so it's 222 individuals, were hospitalized because of COVID. Today, that number is 9%, or I believe 150 people, 160 people are in the hospital. So we really have flattened the curve, both in hospitals and across the city. So, I mean, crossing my fingers, I hope we're heading back in the right direction, and it really is because of what everyone is doing around us.
Okay, great way to end. I do have to ask you, right now, should we be getting the flu shot, like right now?
I think the flu shot comes out in September,
Okay.
And yes, as soon as you can get it, get it.
All right, thank you so very much for everything.